Hi, TRAM. My name is Mackenzie Riley, and I have the pleasure of serving as the Communications Manager for the American Trauma Society. Today, I get to spend a bit of time with you talking about the American Trauma Society and the Trauma Survivors Network, who we are as an organization, our role within the trauma community, and how we can support trauma registry professionals like yourselves in your day-to-day work. So let's jump on in. So the ATS is a non-for-profit organization who's more than 54 years old. We're dedicated to saving lives, improving care, and empowering survivors. You can see on your screen, our vision is a world without preventable injury where trauma survivors thrive. We accomplish both our mission and our vision through 4 primary pillars: advocacy, infrastructure, education, and empowerment. Here you'll see a little bit of how, as an organization, we are living out each of these pillars. So for advocacy, we truly do work to advocate for our trauma systems, care for trauma survivors, and really ensuring the best possible outcomes when trauma does occur. That can be advocating at the state and local level for trauma system improvements, or even at the national level. In terms of infrastructure, we provide our members with real-time opportunities to connect and engage with one another, to learn, to look at resources that are developed worldwide, and to offer mentorship opportunities within our organization. Education is where we offer a whole host of courses, whether it be injury prevention, trauma registry professionals, trauma program management, ICD-10 trauma injury coding courses, a whole plethora of webinars, and so many more opportunities and initiatives. And last but not least, we accomplish our mission and our vision through empowerment. And this truly is where we focus on the Trauma Survivors Network. It is the home of trauma survivors, and truly where we provide resources and support and education for survivors of trauma, their family, and their friends, and both that being locally at a TSN site within their community, or nationally through virtual support groups, online initiatives, and opportunities to connect through Race to Rebuild and all sorts of things. So this is truly, if you look at each of these, it truly does hone in on our mission, our vision, and how we support trauma survivors and trauma community professionals like yourselves on a daily basis. All right, so when we talk about ATS membership, there are a plethora of membership benefits. So for $65 a year as an individual membership, you would have access to all of the benefits listed on your screen. To mention a few, our member pricing on all of our courses, access to free live webinars. We offer at minimum 2 a month, and right now we're operating usually between 3 to 4 a month. Access to our library of archived webinars, and truly access to our certified specialists in trauma registries, or CSTR exam, our preparation materials, mentorship opportunities, and so many other things. So when we talk about information and resources in terms of member benefits, we're thinking more along the lines of our newsletters, which we have 2 that go out throughout the month. Access to information regarding our trauma care information and data, which is our TEP program. Legislation and our position paper. So again, as we talk about advocacy, the ATS creates, through our legislative and policy committee, various different position statements that really do represent, as an organization, here are our thoughts and where we stand in terms of whether it be like recently our COVID-19 impact statement, trauma registry professionals, a whole host of position statements that really give our support to the trauma community. We also offer a ATS member benefits only networking platform, which is called ATS Connect. It is an incredible space for people to engage with one another, to ask questions, share resources, update upcoming programs or events, webinars, a whole host of things. And then last but not least, whenever we talk about community and networking, again, looking at our searchable member directory. So if you're wanting to touch base or network with someone who you recently took a course with or saw on a webinar, you can certainly do that. Connecting again through ATS Connect, our platform specifically for ATS members, and then the ability to truly ask real-time questions within that community. So as you can see here, this is just a brief list of some of our member benefits, but if you visit us online, which is www.amtrauma.org, you can see the full comprehensive list of member benefits that will be accessible to you if you join the ATS, which we hope that by the end of our presentation today, you will certainly take advantage of. So a couple of those member benefits that I really wanted to look at a little bit more. One of those is ATS Connect. So I've mentioned it a couple of times already. It is our networking platform for ATS members. And what's really neat about ATS Connect is that there are multiple different communities or groups within the platform itself. One of which, as you can see on your screen, is Trauma Registry and our data analyst group. So this group has over 1,300 members currently, which is pretty incredible whenever you think about it, because you can only have access to this platform if you're an ATS member. So that means if you join the ATS, you have access to 1,300 other trauma registry and data analyst professionals at your fingertips. You have access to asking them questions, sharing resources and references with them, engaging about important topics for the profession. And so you'll see here just a few of the most recent discussion posts. And so it's really an opportunity for you to ask questions, respond to your colleagues, and engage with them really across the nation and across the world. So another incredible member benefit that we offer are our webinars. At minimum, as I mentioned earlier, we offer 2 live webinars a month. And again, right now we're pretty much operating between 2 to 4 a month. And at least one of those, if not more, is always trauma registry specific. What you're seeing here on your screen is a snippet of our learning management system, which houses all of our ATS webinars, both live and recorded. And if you join the ATS, not only do you have access to those 2 or more live webinars a month free of charge, you also have immediate access to our archived library of archived webinars, which is pretty incredible whenever you think about it. Of those 150, over 70 are trauma registry specific, and they are covering a multitude of topics, whether it be coding, updates to the data dictionary, inter-rater reliability, as you see on your screen. And we are really thoughtful whenever we create these webinars that not only are they trauma registry specific, they're also specific to the CSTR exam and a level of preparation and support there, but that they're truly progressive in nature, and that meaning that they are going to be contemporary in their content, really thinking about the trauma registry professional today and your role and how we can help benefit you with these educational webinars. All right, so let's talk education for a bit. So as you may already know, the ATS offers a variety of courses. The 4 courses that we offer are listed here on your screen: the Trauma Registry Professionals course, the ICD-10 Trauma Injury Coding course, the Injury Prevention Professionals course, and then the Trauma Program Management course. And so while I do recognize a great deal of you who are joining me today, our trauma registry professionals are within a similar role, I never want it to be lost on us the importance of understanding the various roles within the trauma community. So that's why I also included injury prevention and trauma program management in here, because truly the role of the trauma registry professional, as you all know, impacts the day-to-day work of injury prevention professionals, the trauma program manager, trauma program director, and above, right? So that data that you all are collecting and analyzing is truly impacting every facet of the trauma program. And so we want to be mindful of that, because it is absolutely, I would say, paramount that as a trauma registry professional, you understand each of those various roles and the impact that you and your role has within that other profession or other roles, so injury prevention, and how you contribute as a team member to injury prevention in the community that you all are working with it. In addition to receiving member pricing on all of our courses, we've already talked about the monthly educational webinars, which absolutely are, I would say, are a huge member benefit and are utilized on such a tremendous effort on trauma registry professionals. So specifically, whenever we talk about our courses, they're offered in a few different formats. Right now, post-pandemic, we recognize that some people aren't able to travel, or maybe they don't have the support from their trauma center and hospital to be able to travel. And so we offer all of our courses in a 2-day virtual format, as well as some of these are also offered in an evening course format. So think of that 2 days broken up over the course of 6 weeks for a few hours on a Thursday evening. So we certainly do a good job of being mindful that not everyone is able to dedicate 2 full days out of their week back to back to a class, or even over the course of a weekend, and really wanting to meet the needs of our trauma community professionals today and meeting them where they're at. So we've been very thoughtful and mindful of taking these courses, really reimagining how they're implemented, and that is shown here in the various formats that they're offered. In addition to the format in which they're offered, we've really went through each of these courses and updated and in some regard overhauled the content. So it is, again, contemporary, it's progressive, it's meeting the needs of the community today, and then it's also engaging. So something we have learned over the course of implementing virtual courses is that truly we need an opportunity to reach through the screen and engage with you, right? And so whether it be breakout sessions, doing some post-course work, doing some in-course quizzes, and various types of engagement strategies, we've really taken these and elevated that piece of it so that it's not that you're just, you know, getting all of this information, but it's that you're able to interact with it real time, and really be able to take, I would say, more away from it, right? Because the more that you're able to take it in, practice it real time, I would say the more salient it is for you whenever you take all of that learning back to your actual trauma center. And so we've been really thoughtful in creating the content to meet that engagement and those various learning styles. So another component of the American Trauma Society is the Trauma Survivors Network. The ATS is home of the TSN. And truly, the TSN is a community of patients and families looking to connect with one another after a serious traumatic injury. And so the TSN was developed in 2008 to really bring together trauma survivors, to support them, to encourage their growth and their journey, because we recognize that after a serious traumatic injury, there's a significant change, right? And getting used to that new normal and overcoming those challenges is absolutely so incredibly hard. And so the TSN was developed to support trauma survivors and their families. And so a few of the ways in which the TSN helps support trauma survivors is that at local TSN sites, you may work at a hospital that has a TSN site. And if so, that's absolutely amazing. And those TSN sites do anything from peer-to-peer visitation, family workshop groups, peer work groups together. We have a next steps class that really helps trauma survivors and their family and friends think of life after trauma and to really work through their traumatic injury and finding that new normal and that stability post a really challenging situation. And so the TSN has been an incredible resource for so many trauma survivors. And it truly is our goal to prevent trauma wherever we absolutely can. But when it does occur, that we provide support and encouragement to trauma survivors and their family members. And so to learn more about the Trauma Survivors Network, you can visit us online at traumasurvivorsnetwork.org, or feel free to reach out to me after this session today, and I would love to get you connected. Again, this is another opportunity for us to think of the data that we're collecting as trauma registry professionals as more than just data. The work that you all are doing is truly working towards our vision of preventing injuries where they can absolutely be prevented, right? And then also providing support to trauma survivors as they are on this journey to their new normal. And so we encourage you to learn more about the Trauma Survivors Network because it is absolutely at the heart of who we are as an organization, what we do, and who we are and who we love to support. All right. So when we talk about the American Trauma Society and opportunities to really get you all connected, there are a few different ways that you can do that. So first and foremost, we have a whole host of committees and councils. They can range from anywhere. I mentioned our legislative and policy committee earlier to we have a trauma registry and data council, which is truly made up of various folks who represent various positions within the trauma community and the trauma program. And they really look to providing those educational webinars, preparation for the CSTR exam. We're going through a CSTR redevelopment process right now that they are truly leading the way on. So there are a whole host of opportunities to get involved within not only the Trauma Registry Data Council or the TRDC, but our other committees and councils as well. We have a group that's focused on injury prevention. We have a membership group, of course. And so if you're interested in getting involved in one of our committees and councils, at the end of our presentation today, there will be an email for you to reach out to, and we would love to get you connected. We also, as you're aware, offer a vast number of webinars throughout the year. And if you are interested in presenting a webinar, I would love for you to reach out to us. Or if you have a topic in mind that you're like, oh my goodness, we need to learn more about fill in the blank, coding, TBIs, for example, or hip fractures, or a whole list of things. If there's something that you are seeing in your trauma center that you all could benefit from education-wise, reach out to us in that email as well and say, hey, ATS, I'd love to see a webinar about fill in the blank topic. And or I would love to present about fill in the blank topic. We're always looking for experts within the trauma community to come on, teach our community, share with them some points of wisdom and knowledge. And so we'd love to work with you and connect with you. Mentorship, we have multiple opportunities for mentorship. And when I talk about mentorship, I truly mean not only mentoring if you want to be a mentor, but also if you need mentorship, right? So there are two vital roles within mentorship in which we connect professionals across the nation. And again, like I said, across the world to one another, whether that be within your role as a trauma registry professional preparing for the CSTR exam, or a multitude of other things. So if you're interested in being a mentor or a mentee, again, at the end, reach out to us via email and we would love to get you connected. And then ATS Connect, we've talked about it multiple times, honestly, throughout the course of this presentation. But if you want to get involved with ATS Connect, join the ATS, submit your questions, your discussion posts, your resources, or if you have an article that you want to share, be sure to connect with your colleagues there, because it is like I said, an incredible way to reach folks near and far, and to gain perspective and understanding and expert advice from folks within the community. So a few upcoming things that we have here at the ATS. First and foremost, if you are attending the ESO Wave Conference here in just a few weeks, we would love for you to join us at our ICD-10 Trauma Injury Coding course that we will be offering there in Austin, Texas at ESO as a pre-conference course. You can learn more about the ICD-10 course, what you would learn and gain from that program, as well as how to register on our website. Also coming up, we are super excited, is our 2023 ATS conference. So this year, our title is Navigating the Space, the Intersection of Public Safety and Public Health in Our Nation's Trauma Centers. So we really take these two very critical roles whenever we think about public safety and public health and our responsibility as healthcare professionals, and really explore this over a vast, I would say, topical areas. So we're going to be talking about anything from creating relationships with your medical examiner and how that can be absolutely beneficial to data abstraction, to talking about, public safety in the trauma bay and what that means. We'll also be talking about human trafficking and our role as healthcare providers to providing support and resources as it pertains to human trafficking, and recognizing that we do have a substantial role as it again relates to public safety and public health. So again, we have a multitude of incredible presentations on April 14th. We'll be meeting between 11 to 5:30 Eastern Standard Time, and we would absolutely love if you all would join us. It is sure to be an afternoon of learning, engagement, networking, and I'm absolutely positive we will all take something or some things away from it to be able to really learn from and use in our own trauma centers and hospitals. All right, and also coming up here at the end of April, beginning of May, is the 9th annual Injury Prevention Professional Symposium. So this is going to be co-located with the TCAA Annual Conference in Albuquerque, New Mexico, and it is an opportunity for professional development, networking for hospital-based injury and violence prevention professionals, and really a great deal of learning. There are going to be so many incredible presenters and topics at this year's session that we would love for you to join us. Learn more online. Again, you can learn more at amtrauma.org and see how you can get involved with this year's Injury and Violence Prevention Professional Symposium. Race to Rebuild. So we have been implementing Race to Rebuild for a few years now. It is a virtual run, cycle, roll, walk event. And truly it is a distance of your choosing that just has to take place between May 1st and May 31st. This is one of our biggest initiatives where we support trauma survivors on their journey to recovery. It is one way that we as the trauma community and beyond can really support trauma survivors as they learn to navigate their new normal, recognizing that there are significant challenges that they will face, but that we are there, champion them, cheering them on, and supporting them one step at a time. So again, we'd love for you to join us this May. You can learn more by registering and clicking on that QR code on your screen, or you can visit traumasurvivorsnetwork.org to learn more. All right, and National Trauma Awareness Month. Each May, you may be aware, we celebrate National Trauma Awareness Month. And this year, our theme is Roadway Safety is No Accident. As the folks who are coding injuries, abstracting data and analyzing it, you've probably seen a rise in traumatic and fatal injuries as it pertains to roadway safety. We have seen that nationally growing, and we want to take a stance this May to collaborate with partners across the nation to combat this ever-growing preventable injuries, to be honest with you. And that's going to be broken down into a few different ways: passenger advocacy, distracted driving, traffic safety, experience, and impairment. And so over the course of the next week, you will see a good deal of resources, opportunities to engage, learn, connect on the ATS website for National Trauma Awareness Month. So look out for more details and information coming soon for you to be able to engage with us throughout the month of May. And last but not least, Trauma Registry Professionals Day. We celebrate Trauma Registry Professionals Day the first Wednesday each May, and it is our way to recognize the incredible amount of work that goes into your all's day-to-day. We know that it is not easy. It can be challenging and taxing and hard, but we know that you all are vital to the various roles within the trauma program. And we know that you all are truly the backbone of all that we do within the trauma community. And so we want to take this opportunity to celebrate you. You will see more information and how we plan to celebrate Trauma Registry Professionals on the ATS website here in the next few weeks, but mark your calendars for May 3rd because it is going to be a celebration like no other. All right, and last but not least, how you can connect with us beyond today's session. So as I've mentioned multiple times, reach out to us on the ATS website, www.amtrauma.org. You can email us at info@amtrauma.org. You can reach out to us via phone there, and then you also have access to our Facebook and Twitter social media handles. We would love to partner with you all, get you involved, and really connect with each and every single one of you. I thank you so much for spending time with us today. If you have questions about the ATS or membership benefits, educational opportunities that are coming up, or really getting involved in joining us as we save lives, improve care, and empower survivors, I would encourage you to reach out to us because we would love to work with you. Thank you so much and enjoy the rest of your conference.